Hello and welcome back to USA Senior News. There's a new number just released this month that every Social Security recipient needs to hear, because on the surface it sounds like great news. But by the end of this video, you'll understand exactly why a big chunk of it may already be spoken for before it even reaches your bank account. Let's break it down. Here's the headline. An independent senior advocacy group, the Senior Citizens League, released a projection this month estimating that the 2027 cost of living adjustment, or COLA, will come in at 3.8%. That would be a full percentage point higher than this year's 2.8% increase. On paper, that's the biggest raise seniors have been projected in several years, and it would apply to both Social Security retirement benefits and SSI payments for roughly 75 million Americans. Now, before we get to the part that eats into this, let's understand exactly what this number means and where it comes from, because most explanations of COLA skip this entirely. The COLA is calculated based on the Consumer Price Index for urban wage earners and clerical workers, commonly shortened to CPIW. Every year, the Social Security Administration compares this index from the third quarter of the current year to the third quarter of the last year a COLA was determined. If prices went up, based on that specific index, your benefit goes up by that same percentage the following January. Here's something important a lot of seniors don't realize. This index isn't actually built around how retirees spend money. It's built around spending patterns of younger, working urban wage earners. Think transportation to work clothing, and other expenses that decrease significantly after retirement. Meanwhile, healthcare and housing, the two categories that dominate a retiree's actual budget, often rise faster than this general index captures. This is exactly why many senior advocacy groups have spent years lobbying for a different index, specifically one designed around elderly spending patterns, which typically shows higher real-world inflation for seniors than the standard CPIW does. So even before we talk about Medicare, it's worth understanding that a 3.8% COLA is a percentage based on an index that may already be underestimating what your actual cost of living increase feels like. Now here's where things get more concerning. The part of your raise that gets taken before you ever see it. Every year, if you're enrolled in Medicare Part B, your premium is usually deducted directly from your Social Security check, automatically, before the money reaches you. This year, in 2026, the standard monthly Part B premium jumped to $202.90, up from $185 the year before. That's a 9.7% increase, and according to Mary Johnson, an independent Social Security and Medicare policy analyst, that's the second highest Part B premium increase in the program's history. Let's do the actual math, because this is where it gets real. The average Social Security retirement benefit in 2026 is around $2,082 a month. A 2.8% COLA added about $56 a month to the average check this year. But the Part B premium increase alone, going from $185 to $200 and 2.90, took nearly $18 of that increase straight back out before you ever saw the $56. That means almost a third of this year's raise was already spoken for by the Medicare premium increase alone, before accounting for anything else. Now project that forward to 2027. If the COLA does come in at 3.8% as projected, that would add roughly $79 a month to the average benefit. But if Medicare Part B premiums continue their recent trend of significant year-over-year increases, and CMS has not yet announced the official 2027 premium, a meaningful chunk of that $79 raise could once again be absorbed before it ever reaches your account. We won't know the exact number until CMS releases the official 2027 premium later this year, but based on the recent pattern, it would be reasonable to expect a noticeable bite taken out of that headline number. And this isn't a one-time coincidence. This same pattern, a nominal raise partially offset by rising Part B premiums deducted automatically from the check, has repeated in multiple recent years. The number announced in the news and the number that actually shows up in your account are very often two different figures. There's one more layer worth understanding here, especially if your income is on the higher end. Something called IRMAA, or the Income-Related Monthly Adjustment Amount. If your income in a prior tax year was above certain thresholds, currently $109,000 for an individual or $218,000 for a married couple filing jointly, you pay more than the standard Part B premium, sometimes significantly more. If your income has changed recently, for example due to retirement, a spouse's passing, or a one-time capital gain, it's worth knowing that you can actually request an IRMAA reconsideration with the Social Security Administration if a specific life-changing event affected your income, rather than simply accepting a higher premium automatically. Now you might be wondering, is there any effort in Congress to fix any of this? There actually is a bill, called the Social Security 2100 Act, that was reintroduced this year. It proposes several changes seniors have long asked for, including switching to a different inflation index specifically designed around senior spending patterns, and raising the minimum benefit to 125% of the federal poverty line. Sounds promising, right? Here's the honest reality. This same bill has been introduced repeatedly since 2017, and independent legislative trackers currently give this year's version a 0% likelihood of passing. I'm not saying this to be discouraging. I'm saying it so you have realistic expectations, rather than waiting on a systemic fix that historically hasn't happened. So, with all of that context, what can you actually do with this information? First, when the official 2027 COLA and Medicare premium numbers are both announced later this year, look at them together, not separately. The COLA number alone tells you almost nothing about what will actually change in your monthly deposit. Subtract the expected premium increase from the COLA increase to get your real net change. Second, if your income has genuinely dropped due to a specific life event, retirement, loss of a spouse, and you're paying an income-based IRMAA surcharge based on older, higher income tax data, look into filing for an IRMAA reconsideration. This can meaningfully lower your Part B premium if you qualify. Third, review your Medicare coverage annually during open enrollment rather than assuming your current plan is still your best option. Premiums, drug formularies, and out-of-pocket costs change every year, and a plan that made sense 2 years ago may not be the cheapest option for you today. And finally, budget conservatively. If a 3.8% COLA is projected, plan your budget around a smaller net number, factoring in a likely premium increase, rather than assuming the full percentage will show up in your pocket. That way, if the actual increase is smaller than expected after Medicare deductions, you won't be caught off guard. One last reminder before we close. If you ever get a call, text, or email claiming you need to confirm your COLA increase, verify your Medicare premium, or provide personal information to lock in next year's raise, that is not how the Social Security Administration or Medicare communicates. These agencies notify you through official mailed letters or your secure online account, never by asking for personal details over an unsolicited call or message. Hang up, delete it, and if you're ever unsure, contact the agency directly using the number on their official website. That's your update for today. To summarize, a 3.8% COLA is projected for 2027, which would be the largest increase in a few years. But rising Medicare Part B premiums have quietly offset a significant portion of similar raises in recent years, and there's currently no realistic legislative fix on the horizon. Understanding the net number, not just the headline number, is the key to planning your budget accurately. If this video helped you, consider subscribing to USA Senior News. We cover Social Security, Medicare, and retirement updates like this every week, explained simply, with no confusion and no fluff. Stay informed, and we'll see you in the next video.